Hi, I'm Dave Esposito. I'm a vascular surgeon here at the Milford Vascular Institute, and today we're going to try and debunk some myths about varicose veins that are out there in the community. So varicose veins certainly do cause a cosmetic issue. People don't like the way they look, but they represent a real underlying medical problem. So I take care of people with varicose veins. I'm not a plastic surgeon. I really couldn't care less what a person's leg looks like. What I care about is how their leg feels and the safety of their vascular system moving forward. So varicose veins are a symptom of something more serious lying underneath. So if you have varicose veins, you should have them evaluated by a vascular expert. If there's not anything wrong with the veins underneath, then yes, then it's just a cosmetic issue and those can be treated by any cosmetologist. But if there is an underlying venous problem, then those problems need to be taken care of. So that's untrue. Varicose veins are an abnormal process. So not everyone gets them, not everyone should get them. People do get them with age. They're more likely to come with age because varicose veins are caused by gravity, right? Gravity is what causes venous insufficiency, and venous insufficiency is what leads to varicose veins. So it's more likely to get them as they get older, but it still is an abnormal process, and that abnormal process should be evaluated by a vascular specialist just to ensure that there's not anything serious going on. Actually, varicose veins are not solely related to women. Women are slightly more likely to get varicose veins because one of the risk factors for getting varicose veins is pregnancy, and we know that the female hormones also can increase the risk of getting varicose veins. But there are millions upon millions of men with varicose veins. My experience says that usually men's varicose veins tend to be worse, and I personally think that's the case because women, when they notice varicose veins, they usually come to get them treated a lot sooner. Men typically don't care what their legs look like. Their legs are hairy, so they don't notice the varicose veins. So when the men do come in to have their varicose veins assessed, they're usually at a later stage. So men and women are equally likely to get them, and they can have the same risk of getting more serious side effects from the veins. In a way, running can cause varicose veins, just the trauma of running and the stress on the veins. In general, exercise is good for your veins. Walking is the best treatment for your veins, the best way to kind of keep from getting the symptoms of venous insufficiency. But more strenuous activities where you're doing a lot of straining, so weightlifters or power lifters, and really runners who are really pushing themselves, do have a slightly increased risk of getting varicose veins. Actually, venous disease, probably 90% of venous disease happens below the surface of the skin. That's where the real pathology is. That's where the problem is with the valves in the veins. And I kind of look at it as kind of an iceberg. What you see on the tip, the varicose veins that you see on the surface, represent a network of abnormal veins that are underneath the surface. And it's that pressure underneath the surface that is causing those superficial veins to come out. So although you only see the ones that are on the surface, it's usually a sign that there's a lot more going on underneath than meets the eye. Varicose veins can be removed or injected, and they can completely disappear. However, the disease process, which is venous insufficiency, we can treat, but I would never say that we can cure it because it's a disease that's caused by gravity, and we can never escape gravity's pull. So even after we've treated venous insufficiency and we've gotten an excellent result, we still follow our patients for the rest of their life and make sure that they don't get recurrence because of the effects of gravity. So if you've had your varicose veins treated and you're under the care of a vascular specialist and you continue to have good follow-up, it's unlikely that you'll ever need more procedures, but they can come back, and we just have to catch it early so that we can nip it in the bud before it becomes a real serious problem and we have to start all over again. So, I hear that a lot. It's probably technically true. Crossing your legs can cause some increase of pressure. I think on the list of bad things to do, it's pretty low on that list. It is something that can cause some increased venous pressure, which can increase the risk of getting varicose veins. But I think the most important thing is if you can, keep healthy, keep walking, keep your weight down, stay active. Those things I think are much more important. I think if you do those things and cross your legs, you're probably going to be okay. It's for the people who are sedentary to begin with. They're sitting all day or standing all day. They're not exercising much and they're crossing their legs. It's probably just compounding the process. So we've made great strides in just the last 10, 15 years in treatment of varicose veins. When I trained, which is not that long ago, or 18, 20 years ago, we really didn't have any treatments for varicose veins other than the really painful methods like vein stripping, which probably your parents and grandparents know about and are terrified about. These days, all of our treatments are minimally invasive. They're all done in the office. They're all done through needles without any stitches. There is some discomfort with the procedure. Anytime you get stuck with a needle, it's uncomfortable. We use a lot of Novocaine. So most of the time what people feel is the Novocaine. And once the Novocaine kicks in, there's not much to it. Most people tolerate the procedure very well without any pain medication at all. They're up and walking immediately after the procedure. People go to work and go to the gym the next day. So the procedures are very well tolerated and minimally invasive. And I would think that if you ask most people who've had the procedure, they would tell you it's relatively painless procedure. And that's it for today. Thanks for watching and thanks for listening. And if you have any other questions at any time, you can contact us at Milford Vascular. You can call us, you can email us, you can reach out on Facebook or Instagram. Be happy to answer your questions or see you and give you an opinion. Thanks, and stay healthy.